Hello, everyone, and welcome to the Healing with Excellence podcast. This is Kimberly Miller, your holistic health expert, and I am here today with a very special guest, Miss Reese Monroe. Welcome, Reese.
Hello, thank you so much for having me.
Yeah, I'm so glad that you're here. So Reese and I met a few years ago. She was dealing with a unique health issue, and we want to share it here today because there's multiple people of all ages dealing with this health concern. And it's one of the most misdiagnosed issues at the ER that can really cause somebody to have a very disabling life if they don't get the right information. And so I want to just, we're going to go through what Reese's experience was, what I saw it as a perspective as the neuromuscular practitioner, and kind of go through what we did to help her, basically have freedom from this and not get a chronic diagnosis. But our goal is, our intent is to help other people, really reduce their suffering, their loss of time, money, and quality of life, really, because it really can rob your quality of life. So Reese, you're how old now?
I am 18 right now.
Oh my gosh, that's so hard to believe. You're 18. Okay, and how old were you when the symptoms first kicked in?
So I was 13, I believe. And I can't remember like when in the year it was. No,
Mhm.
I think it was in the fall. So I was 13. And kind of how it all started was I had been on a water slide and I had hurt my back on this water slide. And my back had been hurting for like maybe a week or so, and we weren't really sure what was going on. And then all of a sudden, I started having these weird symptoms coming up where I was like almost like losing consciousness, or you probably have like better terms for it, Kim, but just like almost seizure-like symptoms. And I was laughing uncontrollably, and then started sobbing and just lots of crazy and kind of startling symptoms for me and my family. So, one night they took me to the ER to kind of, like, what is going on? This is not normal behavior. And they just took me in and they looked at me and they were like, I think you just have anxiety. Like, this is just symptoms of anxiety. And we were like, okay, this does not seem like anxiety, or it's shocking that anxiety could cause such a large amount of symptoms. And so I went home that night, and then the next morning it was even worse. I tried to eat some oatmeal that morning, but was just like sobbing uncontrollably and was so sad and was having these like weird jerks, where I would be sitting still and my whole body would jerk, and like my head would drop almost like a seizure, but it wasn't a seizure, it was just a symptom. So we went to the hospital again, that day, a different hospital, and they they diagnosed me with possibly MS, um, or a form of epilepsy, and suggested that I get different tests done. And I went and got an MRI done, but there wasn't a ton of answers. I even went and saw a neurologist soon after that, and he just said it was anxiety. So there was a lot of different like answers and confusion I was getting, and none of it was helping. I was still having these symptoms, and I don't know how long it went on for before we found you, Kim. I think a friend, it might have been Shannon Sieber, recommended
Mhm.
you to us. And so you came to our house one night and did muscle testing on me to kind of figure out if there was anything that you could do. And yeah, that's kind of how the journey started.
Yeah, right. It was crazy. But no, you get to give an excellent recap. That's kind of the same things your mom told me when she called me for help. And yes, your Shannon and her family had experienced different healing through the work that we do. And so she referred your mom to me. And then when I spoke with your mom, I'm like, okay, I'm just going to have to come to their house because I don't do many house calls. But with what you had been through, and because I know the longer it gets ignored, the more chronic it can become, I was really passionate about trying to come to you. So I remember even, I think my kids were even sitting in the car waiting while I came in and checked on you. But it's, so a lot of people don't know there's something called intermittent vertebrobasilar insufficiency. Basically, there's a mechanical occlusion that can happen of arteries in the neck and sometimes your nerves based on muscles that are compensating or overworking for other muscles in the body. And what had happened was when you had that slight injury on the bouncy house or the slide, it caused a problem in your neck. And then also like there was a little bit of issue going on in your eye muscles and your jaw. And so when I came over to do the neuromuscular assessment, I had a feeling something in the upper body was compensating too much for something in the lower body. And that pressure that it was putting on the arteries, it slightly kinks off the blood flow to the brain, not enough where the blood flow's not getting through for most people. But when it's kinking off that blood flow, it can cause like your changes to your behavior, your eyesight. And again, if it's hitting the nerves or the arteries at the same time, it can cause unique changes in your neurological function. And like what you felt like the intermittent fainting that you were having, it was like your head would just drop and then it would come back up. So I know what you're saying. And then your mom sent me videos of that if somebody like needed an example to see if it relates to what they're going through, we could share that. But the problem with this issue is that it presents differently in all people, which is why it's hard to accurately diagnose at the ER. And because the mechanical occlusion from the muscle is typically happening during movement, most of the ER diagnostic tools are static. You're laying down, so they can't see the muscle compressing on the nerve or the artery, and they don't see what's happening in the body. And so one tool that's the most successful at diagnosing it is called a transcranial Doppler ultrasound. But like in our area, like only 1 out of the 10 hospitals even has that diagnostic tool, and they hardly ever use it in the ER. So if they're not using it, they can't find it. But the other negative is sometimes if they can find that a muscle is impeding blood flow, many surgeons believe that you just clip the muscle. They don't know that you can do this neuromuscular work to correct it. There's something called bow hunter syndrome, and the omohyoid muscle in the neck, they sometimes just release it. And I'm like, oh my gosh, you saw that we didn't need to cut anything, right? We didn't need to medicate it, cut it.
Right.
So, but so some people with what you've been through, sometimes it's an acute issue and I need to see them 1 to 2 times and it's fine. One woman with your situation, it had been going on for 3 years and her body, like her neck muscles had degenerated. Her husband was walking her around, bathing her. It took us about 6 to 8 months to get everything to correct because of the atrophy that had happened. But again, she healed in her 70s after 3 years of being almost disabled. In your
That's
situation,
amazing.
it took us, I think, about like 6 to 8 weeks to get you 90% better. And then you did things to manage it after the fact. So in some people, it's just fixing the muscle. In other people, we have to change the diet too. So for you, we noticed that you also were starting to have a sensitivity where you needed more protein and then you couldn't have as much grain or gluten, right? Is that what you felt?
Yeah, so I grew up in a pretty standard American diet household. We were just, eating pasta multiple nights a week, like not getting anything organic. All of our, yeah, nothing was organic in our household. Just kind of eating a lot of processed foods. Just because my parents didn't know any better because that's also what they grew up on. And you honestly changed our lives and turned our whole entire eating habits around. Because yeah, we noticed that whenever I would eat anything with like gluten in it or any flours, it kind of spiked my symptoms a lot. And I would have a lot more of those jerks and like I would start crying afterwards.
Mm.
So we kind of took gluten out for a while, and started eating a lot more organic foods. We were on steak and potatoes, which is still one of my favorite foods to this day.
Mm.
And it was amazing just how it changed and made me feel better. Like the symptoms started to go away. It was not immediately, and had to be paired with the exercises, of course, that you had given me. But just it was amazing how food was able to help me and
Mhm.
just, yeah, make me feel better.
No, that's amazing. And a lot of people don't realize like certain foods we eat are very high in B vitamins that help our nervous system work. And then also certain foods we consume might block our nutrient absorption. Or maybe if it's like
Hmm.
non-organic flour, oatmeal, the pesticide could impact how the nervous system communicates to the muscles. So it can kind of cause a misfire. So I was so excited when you started learning this and to see you like at 13, 14, 15 doing so much cooking. Did you remember how much you started to cook after that? I know you love
Yes.
to bake. I know
Yes.
you love to bake before that.
Yes. No, I would bake every day before that. And so when we kind of started taking out flour, it did like slow it down a little bit. But then I turned to cooking instead and was making so many dinners and just kind of fell in love with food and like all the options and kind of realized how much power I had, that I could heal myself if I put in the work of making, good food for me. And I could also make it for my family too. That was even better.
Yeah. Well, now what's so exciting is what you probably already noticed. Not only does it help with what you had, but anybody in your family would feel better if they made some of those
Hmm.
nutritional changes, like whether it's helping with like something as simple as blood pressure or helping with some kind of skin rash. A lot of, or even like you said, like it could change your mood to where you have better energy and happier. But correct me if I'm wrong. I think you overall, before that injury happened, you had a pretty good disposition. You're a pretty happy person. Like you look very smiley. But then when this happened, it looked like it took away, like almost like it was robbing your soul or your spirit, like your spirit was not shining through when I saw how your body was reacting with those symptoms. It looked like a completely different person.
Yeah, it definitely affected me. And I did get a lot of anxiety during that time too.
Mm.
And I think that was because I was eating so much flour and not getting enough B vitamins.
Mhm.
And so that was already blocking it a little bit. But yeah, I just was not in a great place mentally and didn't feel very happy. And so it was really good when we were able to reverse that and kind of get back to normal.
Yeah, and it's true, like when anybody in their teen years, early 20s, we go through ups and downs with our mood anyway. But if somebody doesn't know that there's a neck muscle problem and a B vitamin deficiency, and they just say, oh, it's anxiety, and they don't actually help you address the root cause, it could just continually decline where you're on these antidepressants or anti-anxiety meds. And then if they did misdiagnose you with MS, then it's a whole round of medications for that. And then what
Mhm.
ends up happening is the treatment or the protocol is what actually creates the disability, not the actual root cause. It just, they missed the root cause. And because it progressed, then it gets, chronic. But now I can say one of the reasons I came to your house is studies do show that 20 to 30% of strokes do happen because of this neuromuscular problem, but most people won't push through until it takes place because it starts making you feel so awkward or like you felt with the fainting that they'll slow down, they'll rest, they'll go to sleep, and then the muscles will relax. And then they'll be fine until they build up a threshold again, and then they tighten and press the artery again. Now, that's when that first physician at the ER told your family it was just anxiety, and then your mom took you out in the woods to like help get you fresh air and get you in the forest, the trees, and then it became very difficult for you to get out of there, and you had to sit down on that like bench or that swing where the wrong what those very dangerous information that the medical professional gave you, because if you have a neck muscle that is contracting greater than what it's supposed to and it's working for other muscles like your glute and you're walking, it's going to keep getting tighter, and the tighter it gets, if it cuts off that blood flow enough, someone can literally have a stroke. And that's why your head kept like dropping down. And can you believe they just said
Yeah.
that was anxiety?
I'm still surprised to this day. It's hard for me. I think the what you're talking about is like a video that my mom took of me.
Mm-hmm.
And it's very hard for me to watch that video, just because it's so triggering that somebody could look at that and call it anxiety and
Mm-hmm.
just not, help with it or give me anything that could help. But I'm just so glad that we were able to figure out, what we could do, and find you and be able to get muscle testing done. And it was definitely a process, to recover. It did take like 6 to 8 weeks, with you. And then it took a while on my own too to get rid of symptoms. And that was really hard for me because I was 13 or 14,
Mm-hmm.
to, you know, be on this. It was kind of a diet, like cutting out
Mhm.
gluten and not eating as many processed foods or not eating out. And so that was hard for me. But the reward of feeling good again and getting rid of those symptoms was so much better and so worth the time and effort. Because during that process, it feels like it's never going to go away or like it's impossible to get better. And so I'm just
Mhm.
so happy that I had my mom to kind of help me work through it and, you know, keep me on that path of eating the right food so I could heal.
Yeah, no, I'm grateful for you sharing that because it's right. Because if someone hasn't dealt with that yet, especially in your age group, you're going out with friends to lunch or dinner or holiday events, and everybody's just eating whatever they want. And you're like, oh gosh, I
Exactly.
have to set boundaries. I can't eat all of these things. But when you do see the benefits of it, and what's so amazing, even though it was a tragedy, what's so amazing about you learning this now, it's going to completely alter your life's trajectory, like the health of your children, the health of your family. It's going to prevent so many chronic things. And what some people don't realize, it is, scary to change and it's a lot of effort, but envision how big that effort is when you don't get better. If we don't make those changes, all the doctor's appointments people have to manage, the medication, and then the symptoms, it's so
Mhm.
exhausting to just live basic life when really there were some answers that if we put in, a few months of good work and then just dedicate to kind of nurturing our body a little bit better than what we were, how amazing the body is and what it gives back to us, right?
Yes. Yes, that's so true. And I live a very busy lifestyle right now. And so I'm running around and doing a lot of like physical things. And so I just feel so much smarter about my food now. And I know like, oh, I'm gonna have a long day tomorrow. I need to make sure I'm eating lots of protein so I can get through the day and making sure I get enough calories and getting my B vitamins in, or on the days where I'm resting, I go sit outside in the sun to get, some vitamin D in. So just how it's changed my life is insane. And so I'm honestly thankful in a way that I had that injury and whole experience because it has helped me for the better and changed my whole life. So, yeah.
Yeah. No, I think what looks to be a curse for some people or a test is typically the testimony or the blessing. And I think it really is a gift. And like you said, you might be learning some of this to help people in the future. So I'm super excited about that. But the other big thing, like even what I was, get saddened for people, exactly what I went through, some of what your parents went through with you, is after that physician told them the anxiety. And then you went to the other ER and they assumed possibly MS. In that same time frame, I had another gentleman that worked as a correction officer that he had the same similar symptoms as you, and he was 28. Another ER locally told him the same thing, that he might have MS. So he was scared he was going to be disabled with his children. Luckily, his was very acute. It only took us 2 sessions and he was taken care of. But what I was disheartened by is how many people are being told the same thing without any accurate even diagnostics for MS, just to tell that a family that what it weighs on their heart and what they're thinking. You kind of have this flash forward vision of your life. And it's I think it's very unethical or negligent to just throw these big names around and create that level of fear, because it will also increase symptoms. And then one thing with your parents, they had a pretty decent copay for the ER. So I think it was like close to $900 or something that they paid for those 2 ER visits for no answers other than more fear and more letdown. So it just gets sad for me that individuals that are putting out their good money, their insurance, their time, and then not, like you said, he looked at you and just instantly seeing anxiety when you're like you are purposely, or your nerves are just dropping down your head because you're anxious, and not digging just a little
Mhm.
bit deeper, or not thinking a little bit about controlling the words that they put out over your life. That's just sad.
Yeah, no, it is very sad. And I'm able to see so many people get, diagnosed with crazy things. And I know personally that they might not have even gotten that diagnosis if they'd done just a little bit of work, and changed what they were eating or had gone and gotten muscle tested. That could have changed everything. Yeah, so it is really sad. And hopefully something that we can continue like fixing though. And even just in people's everyday lives. I think that they can improve the quality of their life, even if they don't have any crazy symptoms. If
Mhm.
they have headaches every day, that's something that could possibly be fixed by muscle testing, or by changing their diet or the products that they use in their house or lots of other things, then it could change their symptoms.
No, you're 100% right. Just mild irritating symptoms can weigh on somebody every day. You don't have to get a big diagnosis to feel frustrated or exhausted. And honestly, those mild symptoms are basically your body communicating with you that something is off. If you find out when those mild symptoms are here, it helps prevent a lot of those tragedies. And yeah, like you said, if people, it's kind of like if you're driving a car, after you put so many miles on it, it needs to get in alignment. It might need a tune up. Well, we're all putting a lot of miles on our car. You said you have an active lifestyle and you just need somebody that knows how to look at the whole body and can basically get it back into alignment, not just like through putting your bones in place, but looking at your neuromuscular system, looking at your stress, looking at your nutrition. Like, is somebody getting the right macros and micros for your cell function? But no, you're right. And just a couple things, like most people are doing their best to find the answers and they feel they're going to the experts. Like I went through a few ER visits and I thought, okay, wait a minute. I went to all the experts and they have no answers. They told me the same thing. It's anxiety, it's stress. I'm like, okay, so I'm just supposed to live with this the rest of my life at like 19. And so when you went to the experts and you feel there's no other hope, you assume, okay, then I got to take the label or I have to live with it or I just have to take the medication. And so it can get overwhelming and disheartening for the average person to try to figure out the right thing to do, so to speak, for their body, right?
Yeah, and I liked what you said, the doctors aren't looking at the whole body, and that's something that you do really well, is you look at the whole body. You look at the mental side of it, how your patients are doing mentally. Are they happy, sad? Like, what's going on there emotionally? How are their relationships in life? And then you look at their body, you look at, what muscles are compensating for other muscles, and
Mhm.
then you look at, their lifestyle and what food they eat, and other things. And so I just appreciate how you look at everything that's going on. And I think that's why you're able to heal people so well, and help people, change their lives, is because you look at everything. Um, and that's not something a lot of the medical world is doing.
Yeah, sadly, we have specialties to like help with scope of practice and to help with people being like, again, if I want a heart surgeon, I need a good heart surgeon. But when we're going to just general medicine, sadly, like let's say you do have a neurologist and a chiropractor in your primary care, very rarely are they comparing notes and working together to look at the whole person. And it's funny when you said whole person, sometimes when we share the word holistic, people think it's like some airy fairy thing or something, but holistic just means looking at the whole person, their whole life, the whole dynamics that they're dealing with. And so for you and I, even after the back injury, we have found an eye muscle doing something, and you were an avid reader. So part of the muscular problem was how many hours you loved to read. One of the muscles was very dominant in your eye, adding to the symptoms. And then you had some personal pressure, stress going on too, that was triggering it. And a lot of people don't realize
Mhm.
that these stressors kind of compound. I teach that course, Customized Cell Regeneration, where I'm teaching people how the cells get past a stress threshold and then they can't communicate correctly, they can't renew effectively. So when you and I discussed some of the personal pressure, just growing up, being a teenager, and then the reading, and again, it didn't mean you had to stop reading. We just had to fix the eye muscle issue, and then the slight injury.
Right.
But yeah, it is the whole person. And something I want to clarify for the audience is you've said something a few times, which is excellent. You said muscle testing. With some people in the holistic world, they've heard of something called applied kinesiology, where they're asking the body questions in muscle testing and they look, is the muscle strong or weak? This is not that. So some people don't realize there's different types of muscle testing. This is a neuromuscular assessment where we're looking at the muscle testing that like a physical therapist or neurologist would do, but we're also looking at other parts of the body that aren't working correctly or they're overworking. So kind of like what I want people to think about is the body is like an electrical system. Like if I went into my house and I went to the breaker boxes and I wanted to see which breaker was flipped or see which one had no energy, and the electrician would test that, that's what I'm doing. I'm going through the muscle system and going through which nerves are talking where and which ones are not communicating correctly. And then basically all I'm doing is flipping those breakers back over, like whichever ones are blown or whichever fuse is blown, trying to like replace that. That way the brain can communicate effectively to the right muscle at the right time and stop causing
Yes.
this havoc in the body. Does that make sense?
Yes. No, I love that analogy. That was one of my favorite things about you is you explain everything so well. So people who like me who don't know the medical terms, as well, it makes perfect sense. So,
Oh, good. I appreciate that. Thank you. No, but no, and that's, I think, if you felt anything like me when I was going to the ER at your age and a little bit older, you start to get a little fear too when you're going to the experts and there's no answer, or you're just being told it's anxiety. For me, part of my healing happened when I felt heard or when I felt like things made sense. I'm like, okay, now I feel a little safer because, when you, all these
hmm
symptoms crept up and your family's like, what is this? And you're left kind of in the dark by yourself with MS and anxiety. And then you start to get support where someone's giving you some competent science behind what could be happening. I don't know how that felt for you, but for me, it made me feel a lot safer and helped with my healing process.
yes, it definitely did help. And I think, that's why I was able to heal. And like I think I said this before, it definitely isn't a straight path when you're healing. You do go through ups and downs. And even now at 18, I still struggle with things, making sure I'm getting enough food and doing all the right things. But you've given me the tools where I know now how to heal myself. And I know that if I'm feeling tired, maybe I just need to eat a steak, or
Mhm.
have a really good meal, and that'll help me feel better.
Yeah, no, that's amazing. And I tell people, again, just like a vehicle, sometimes you just need to do a little maintenance, like go in for an alignment. And that's what I love about the majority of my clients, even the ones I had to work with for years on a chronic issue like Lou Gehrig's disease or MS or something. I might have had to see them a lot up front, but now they're like you, they're so empowered. Like maybe they need to see me once a year, once every 2 years, maybe once a quarter for preventative care, but they really kind of know a lot of how to fix themselves. And they only come back to me like if something special comes up or if they're just looking for like aging well and they want to be preventative. And so I'm grateful that you've been so empowered to like keep yourself well.
Yeah. And yeah, it's such a unique journey, going from, you know, having all these symptoms to not having them, but still having to keep up with myself. And I can start to listen to my body and notice different things where maybe I never would have learned how to listen to my body as well. Or, you know, just feel what it feels like to, be in such a dark place of, pain or, yeah, just confusion on what the medical world is telling me versus what I'm experiencing. And so I just think, yeah, I've learned so much since then.
No, that's exciting. And again, it's going to help you in so many ways. What I'm grateful for is like we have this international healing with excellence team now where we have all these different specialists that have been trained with this method now, nurse practitioners, physical therapists, massage therapists, and we're all working together now. So where if we meet with somebody and we need somebody on the team that has a different specialty to kind of do the follow-up support, we're doing that. But I'm thinking you're going to be one of the people on our team in the future because where you're going to do extremely well and you're already doing well is like we talked about earlier, like life coaching kind of thing. You had to like coach yourself through the process of change and being willing to change and to commit to it. And then you're kind of self-analyzing very well for your age. Like many people can't do that till even after the age of 25, or maybe some people never do it. But it's very exciting to
Yeah,
see you self-work on the accountability because again, people, it's tough setting boundaries in the current ways of the world, but it's worth it. It's going to give you a big return. But I could see you really helping other people that are struggling with that much life change to save their own life. You kind of helping hold their hand through that process and having the empathy with them to say, yeah, no, I know exactly how you feel, but these are the rewards for your efforts and helping them through that process, right?
yeah. Even just in regular everyday life, I can see in my friends or in people that I'm around different things, that I wish I could help them with. like whether it, like I said before, everyday symptoms like maybe a headache or just pain in their back. Um, and that if they could do different things in their life, and they could change those. And so it's something that I'm really passionate about and hopefully can someday take courses from you and learn more about so that I can help hopefully help these people someday so that they can feel better too.
Yeah, you will. And something I'm going to share with you now that maybe the whole audience won't want to hear, but this really helped save my life, especially because when I went through a similar healing process as you, and I thought when I was incurable at different points in my journey, when I healed, I wanted to save and help everybody. And then some people, like, especially depending on your age or your degree or whatever, they aren't necessarily always ready to listen, or they don't want to listen because they don't want to change. In the book of Matthew, it explains that you're supposed to come into the house, share my word, and then shake off the dust. So you're going to have things laid in your heart. And I know that your family's Christian. You're going to have things laid in your heart that you're going to share, but they're not always going to be ready to hear. And sometimes you'll be upset that someone that you love doesn't trust you, so to speak, with like this
Yeah.
health change, or they don't believe, but it's not that they don't believe, it's just they aren't ready yet. And so your goal is always to be obedient, but not to let it get to you. You got to shake off the dust because it will weigh on your heart if you let it worry you too much. And I tell people, Jesus couldn't save everybody, so either can we. You just do what you can. But the other big thing that's in that same book, because a long time ago, I was actually going to quit doing what I do. And I was just going to go back to the corporate world because, in the facade we live in, it's really hard sometimes to share truth and people understand it. Well, also in the book of Matthew, it explained that like Jesus was just the son of Joseph, a carpenter. Like, who is this person? He was looked at like almost like a peasant in his own town, but could heal around the world.
Right.
So you will face a lot of those same challenges. But if you keep in mind, like, you're just supposed to be obedient, you're not supposed to be validated by man, and that you just do what's laid on your heart. And when it's that person's time to see and hear, they will be able to see and hear. But when they can't initially, it's not because you're not enough or they don't love you or trust you. It's just they don't see it yet. Does that make sense?
Yeah. No, that's really cool. And I just love the way you said that. Yeah.
Yeah, it will definitely help cause you, it'll save a lot of stress. And I'm so grateful that we can share that now. And hopefully it'll save somebody else that's going to listen to this podcast, because it's awesome to know that. I'm just so grateful that you're getting to learn this stuff like 15, 16 years earlier than I did. So you're going to like really change the world. I'm so excited for that.
Oh, that's so sweet. Thank you.
Yeah, you're welcome. So Reese, I want to appreciate you for your trust because I know it's not always easy. It's like this crazy lady's coming in my home, has me on my living room floor. Is she really going to know more than the doctor at both ERs? It can be scary to know when to trust. So I appreciate that you persevered. And I just know that your life's going to shine a light on so many other people. So thank you for being brave enough to even do this podcast.
Yes, of course. No, at first I was definitely very not freaked out, but a
Yeah.
little worried because when somebody tells you to rub your inner eye and that's gonna make your symptoms go away, you're like, what? But no, anybody else who I know has gone to see you, I implore them to please just stick with it. Even if it's hard, even if it takes a long time, to just stick with it because it will do some good and you just have to stay on track even if you get discouraged, because it will help you eventually.
Yeah, no, I appreciate it. And people don't realize sometimes the cells have to regenerate. So that all takes time. Just like when you burn yourself on the stove and it might
Yes.
take 2 weeks for that skin to heal. There's a lot of cells in here that have to regenerate or slough off and new cells come in. So yeah, no, I appreciate you keeping people motivated. But that's what I'm saying. I think you're going to be an awesome life coach helping through this. And then for those in the audience that don't know, Reese is going to be taking the neuromuscular restoration course in the future. So when she gets that done, definitely call on her for future healing because she's going to be one of the best coaches you could have because she's personally lived it, living it, applying it, and being able to relate with what happens to those emotions is way more valuable than what the textbook could tell us to do. You know.
Yes, thank you so much. I am so excited to eventually take this course and just help people because that is, after experiencing it, it's something that I want to do. It's just help people. And so I'm so glad that that's what you do. And thank you so much for helping heal me and all of the other people that you have helped over the years.
Yeah, thank you, Reese, and thank you so much for being here with us today. Everybody else, send us any questions you have, messages, anything you need for clarification, and then just get ready for the next Healing with Excellence podcast because the interview is going to be excellent. Have a great day.